Hello, my name is Katie Abbott, and I'm an associate professor of gerontology at Miami University in Oxford, Ohio. I'm the co-founder of Preference-Based Living. Our mission is to contribute to the science and practice of precision healthcare. We build knowledge regarding assessment of individual preferences for everyday living. We test innovative methods to integrate preferences into care and assure that preferences are honored for persons receiving long-term services and supports. We know there have been a variety of changes in how care is provided due to the global coronavirus pandemic. One major difference is that we are all wearing face masks, which can create communication challenges, especially for individuals living with dementia. We have asked 2 of our Preference-Based Living team members to share some quick communication tips to support you as you are providing care. Thank you for caring for our loved ones during this time of challenge and opportunity. And now I want to introduce our presenters. Dr. Kelly Noman Porter is the Robert H. and Nancy J. Blaney Assistant Professor in the Department of Speech Pathology and Audiology at Miami University. She is a Scripps Gerontology Fellow and has over 25 years of experience working with adults with language and cognitive disorders resulting from stroke, brain injury, and dementia. She directs the Neurogenic Language and Cognition Lab, where her research focuses on the development of evidence-based restorative treatments and compensatory communication strategies for adults with cognitive linguistic deficits. Our second presenter is Dr. Vanessa Burshnick. She is an advanced fellow in geriatrics at the Durham VA Medical Center. She is a speech language pathologist and researcher specializing in memory and communication interventions for people with dementia. Vanessa's overarching research goal is to optimize evidence-based memory and communication interventions for people with dementia to improve implementation and utilization in care. Currently, her research examines supportive strategies for helping persons with dementia participate in nursing home care planning. So I'm delighted to bring these 2 experts to you and want to turn it over to Dr. Kelly Noman Porter to start our short seminar that we hope will be very useful.
Thanks for that introduction, Katie. That was very nice. And thanks for giving both Vanessa and I the opportunity to talk about a topic that is very near and dear to our hearts, and that's finding methods to help all older adults communicate effectively and efficiently with those who care for them and who love them, that are around them every day. So, as many of you may know, many older adults do experience hearing impairment and other health conditions such as stroke or dementia that can affect their ability to understand spoken information. In addition, many of these older adults also experience difficulty expressing their wants and needs. Because of these limitations, many residents are reliant on nonverbal cues, and these can include nonverbal cues such as facial expressions, tone of voice. Both of those areas can contribute to the understanding of what is being spoken to them about their care or their interests. While the use of facial masks are necessary during the current COVID environment, these masks can also soften our voice and mask our tone of voice and facial expressions, making communication more challenging. For example, just this weekend, I was in an environment with fellow colleagues, and we were assessing different individuals with communication challenges, and we were all wearing our masks. And even though we were communicating, I felt like I was missing something. And it was those very important facial expressions and tone that went along with their communication. And it just made communication a bit more challenging, even between me and my fellow colleagues. So that, on top of the challenges that many adults experience, may make communication more challenging. Therefore, it's important to add additional methods other than just speech alone to facilitate understanding. So today, Vanessa and I are going to discuss some different methods that you can use in isolation or combined while wearing a facial mask to improve communication with older adults. Specifically, we will discuss ways to use your body position, speech modification techniques, gesture support, written support, communication boards, and modified PPE. Next slide, please. First and foremost, what we would like to discuss is proper body positioning when communicating with an older adult. First, it's always important to remember to face the person you are speaking to. Very commonly, when we are entering a residence room, we often knock on the door and announce that we're coming in when we're walking through the door. However, with a mask on, that is going to muffle that. While it's still important to do that, once you enter the patient's room, make sure you come up beside the bed or beside the chair they're sitting in, come up to them, touch them on their arm to get their attention, and then try to face them to have your introductions. If it's possible, try to position yourself at their eye level so that they can see you clearly. I really like this image in the PowerPoint slide where you can see the caregiver is down at the resident's level, and you can see they can kind of make eye contact and therefore communicate more effectively. It's important to remember to use this proper body positioning technique not only when you're speaking, but also when you're using other alternative communication methods like gesturing, writing, or picture support that we will be discussing further in this presentation. Next slide, please. The next topic area I'd like to discuss is how you can modify your speech when wearing your mask to improve understanding. Masks can dampen the volume and the precision of our words, so it's important to speak clearly when wearing a mask. I like to use the word over-articulate. So try to over-articulate your words. Even if you notice as I do that, it naturally reduces my speaking rate or speed of my speech, which again facilitates understanding. Another thing that's important to do is to increase your volume. Since that mask muffles your volume, you need to increase your volume, but do your best to try not to yell. By yelling, it actually muffles and modifies your speech to a way that makes it less understandable. Also, because older adults often have hearing impairment, and they have more difficulty understanding higher frequencies. Because of that, if you notice that you speak at a higher pitch range, you might want to decrease your pitch to a lower level in order to help them understand your speech to a better degree. Next slide, please. Another method that you can use to facilitate what you are saying to your residents is gesturing. Gesturing is a way to express information with the use of your hands. Many of you may have done this in the past when playing a game of charades. I have to admit, I've been working with individuals with communication challenges for a long time, so a lot of times I automatically speak with my hands or use gestures to try to facilitate what I'm saying. Probably one of the most common gestures that we all can use is a simple way of greeting or saying goodbye to individuals, and that's just by saying hello with your hand, or goodbye, just a wave like that. Oftentimes when I'm entering a person's room, I will walk up, like I said before, get face to face with the resident, touch them gently on the arm, and then I will say, "Hi, how are you today? Are you good? Are you not good? Okay." So you can see that I am using gestures to facilitate what I'm saying, and I actually encourage the people that I'm working with to use the gestures back to me. and also to make sure that I am truly understanding how they're feeling. So if I say, how are you? Are you feeling good? I encourage them to either speak back to me or they can give me a thumbs up or a thumbs down also. You can also notice that when I do that, I raise my eyebrows and my shoulders when I'm asking a question. So, how are you? So if they cannot see my face, they might get that kind of questioning look in my eyes and also in my shoulders. Okay. You can relay a lot of information with gestures. Next slide, please. For example, if you're wanting to know about someone's wants and needs, you could, for example, walk into the room, ask them how they're doing, and ask if they need to have a drink. Common gesture for drink is bringing your hand up to your mouth and like this. So you can say, how are you? Would you like a drink? Okay. Yes or no. Okay. Also, don't forget to reassure the person that you are listening to them when they are speaking to you. So if a resident is speaking, make sure you nod your head, either in affirmation or disagreement if you do not understand what they're saying. That will allow them to understand that you are engaging with them in the conversation. Don't be afraid to use gestures. Be creative with them and try to use a common gesture that will relay meaning. A lot of people will let you know if they understand or don't understand the gestures, so don't be afraid to experiment and find a good gestural communication program that will work for that individual. At this time, I'm going to pass off the presentation to my colleague Vanessa, and she will continue the discussion on communication strategies.
Thanks, Kelly. So we're going to pick up talking about external strategies, and external strategies are called external strategies because they rely on using materials that are outside of us. So while Kelly was talking about ways to use our body and our speech, these are ways to support communication in an external way. So the first way we're going to talk about that is writing, so written strategies. These sorts of strategies can help people comprehend as well as express information. So how you might do this is to write down keywords on a piece of paper or a dry erase board. It doesn't have to be anything fancy. And this can help a person follow along with the conversation. So if I wanted to talk about their medication, I might write that medication on the board. I actually have a board here next to me. So you would take your board and you would write the keyword on there. You can also use it for choice making. So if a person is making yes, no choices, you could write yes or no on the board and ask them to point to either one. And of course, you can use it as well to help them communicate. So if this person has preserved writing ability and can write the message they'd like to say, you can use that strategy as well for that. When printing on the board, we recommend that you don't use cursive or script. This is much harder to see. So just printing, sort of like I've shown here in this example, and also making sure that there's good contrast. So use a dark marker like this one, and use a white background. And if you don't have a whiteboard, you can always laminate or use a sheet protector on a piece of paper. That's a really easy way to create a reusable and cleanable communication aid for writing things down. Next slide, please. Communication boards, and there are a variety of them. These are basically boards that contain pictures and or words, and they can be useful in a variety of ways to help a person communicate different needs. They can also be personalized. So as you can see over here, this communication board in particular has very basic medical needs such as thirsty. This is specific to COVID-19, so this can allow someone to ask about updates on their case. Bathroom, what is the time? I'd like my TV turned on and off. And these can be really useful in selecting specific needs and having conversations with a patient. providing pictures really helps improve comprehension and expression as well. In terms of a custom communication board, so let's go to that second slide, or the next slide after this one. Yes. So we always recommend a person-centered approach when it comes to making communication boards. However, we also acknowledge that something is better than nothing. But if you have that option, here are 2 templates for how to make a personalized board. And you can include pictures such as the person's favorite foods, maybe important people in their life. And this can be used as an effective tool for communication. Another tip is to just make sure that the pictures are clear, large enough, and that they are on a plain background so that the subject of the picture is highlighted. And lastly, for sanitation purposes, it would be wise to laminate the board and leave it in the person's room and just wipe it down as needed. Next slide, please. Okay, so our next slide, we're going to talk about modified PPE, and the first modification we propose are face masks with clear shields, and these can be available by order. You can order them online from a variety of sources, providing they don't have too long of a wait. And you can also make them yourselves, and we have a resource for that on the final slide. What's most protective, or what's most important, is that it is providing the same level of protection. So just make sure whatever strategy you're using to sort of create this clear face mask, that it has the same level of seal and protection as another face mask would. Okay, next slide, please. And the second modification we'd like to share are picture name tags, and these can be especially helpful for people with dementia who have trouble remembering names. And especially when we can't see the person's face because of the PPE, we might benefit from having a picture of ourselves on the front of our PPE, just like these people have shown. This comes from an article from insider.com, and what's simply displayed here are the person's first name, their position, registered nurse, and then just a picture of their face, a real clear and big picture of their face that is affixed to their gown. Next slide, please. All right, so just some final thoughts. Supporting communication is really important. It drives person-centered care. You know, it's really crucial to our ability to understand and address the needs of our patients. And you know, we've discussed a variety of methods here. Everybody is different, so all we can encourage you to do is try. And not all techniques will work for all people, but we just hope that you try things out and see what works. And you know, for more complex cases, for someone who has a diagnosed speech and language impairment, we of course encourage you to consult your speech language pathologist for more of a specialized treatment. Next slide. Go ahead, Katie.
Awesome. So this has been fantastic information. Thank you so much, Kelly and Vanessa. Here are some resources that we've found. Again, we'd love for you to hear what you're doing that might be useful for you. And so we've also included on our next slide here our email addresses. Please write to us with your questions. We will absolutely get back to you. If you want to filter them through me, then I can share them with Kelly and Vanessa as well, or you can write any one of us individually and we'll share the information. Again, we just wanted to provide these quick tips. We know that wearing PPE may be a little bit alarming to individuals with dementia, and we thought these might be some ways that could help ease the path to providing care in a safe way. Again, thank you all for the work that you're doing. And again, reach out to us, please. We'd love to hear from you. And we hope that you have a great rest of your day. Thanks. Bye-bye.